Yeah, we're trying to understand a little bit more about what exactly we're breathing in. So Dr. Sunil Joshi is joining us this morning. He's with the city of Jacksonville, and as far as what we've been breathing in through our lungs, I mean, is this something we should be concerned about?
Yeah, I would say that you should be concerned about it in particular if you have health conditions that affect your lungs, like asthma or COPD or chronic bronchitis, because in those scenarios, almost anything that's irritating can affect your lungs. But here in this case, especially yesterday when our levels got really, really high, you're breathing that in at a higher concentration. And so that can definitely drive some inflammation in your lower airway.
Would this be something we should consider dangerous?
It can be. So if we get into the unhealthy levels, which is when we're above 150 of those 2.5 micron sized particles in our atmosphere, that starts to become unhealthy for all individuals, but in particular those who have sensitive airways. So our asthmatics or COPDers, being outdoors when we're in the truly unhealthy air quality levels can be hazardous to their health.
I know earlier you were mentioning the particular groups of people that are vulnerable to wildfire smokes: pregnant women,
Yeah.
older people, children. I know a lot of parents watching might be a little concerned about their kids going to school this morning, maybe waiting at the bus stop, going on field trips, going to the playground. I know you mentioned Duval County Schools is monitoring
Yes.
conditions, but as far as parents and their concerns, is there
Yeah.
anything they should be on edge about?
Yeah, I think the parents should be most concerned if their children have respiratory conditions, in particular asthma. And so if your child has asthma and we are in that orange level, which is when we're unhealthy for sensitive individuals, you really should prioritize indoor activities for your children at that time. And certainly if we get into the red level, then I would prioritize that for all of our kids at that point in time. And follow the lead of what your schools are telling you as well. So you got to keep in mind that the DCPS is in close communication with our Emergency Preparedness Division. And so they're monitoring the air quality. And so if they see this large uptick, the principals will reach out to the parents.
Good point. And as far as the schools in the region, you mentioned that because they're in different parts of the
Yeah.
city, they might not be experiencing the same thing as other parts of the city, right? I know you also mentioned as the day progresses, smoke could clear up. It did here, just in downtown Jacksonville,
Yeah.
if you were with us earlier, was smokier, but it has cleared up since. That also helps, right?
Oh, absolutely. So again, you got to keep in mind Jacksonville has 842 square miles. So what's happening at the beaches is going to be completely different than what's happening in Ocean Way, right? So or on the north side. And so there are going to be differences in air quality throughout our community. And as the weather changes, the wind shifts, a lot of things will change. And it can change within an hour. You could go from great air quality to awful air quality and vice versa, like we've seen here this morning.
Yeah. Dr. Sunil Joshi, thank you so much for joining us this morning, Chief Health Officer of the City of Jacksonville. We're going to get some more information to you as well online at firstcoastnews.com. You can get some more wildfire information there that we've been tracking since the beginning of all of this. But for now, live in downtown Jacksonville, Fariha Abrar, First Coast News, on your side.